excited that you're here for our Tri-State in the Community Forum. And this forum is around healthcare and wellness. Before I introduce our moderator, I'd like to thank the Memphis Health Center for allowing us to have the forum here today. And I would love for the President and Executive Director for the organization to come forward and officially welcome us, Ms. Lois Stockton.
Good evening, everyone. We are more than pleased and thrilled to have Tri-State Defender here with us. This is an asset to us. Tri-State Defender has been around 3/4 of a century, and we've been around half of a century. So we are partners. We're here for the community. We are here to keep people healthy, and they're here to help us spread the word. You're welcome. Come anytime. We're so happy that you chose us to have this forward. Thank you, and come again.
Mrs. Stockton, and Mrs. Stockton said that the Tri-State Defender has been around a long time. We are in our 74th year, and we are so proud to continue to provide news to the African American community and the community at large. But we are here to talk about what's going on when it comes to healthcare, and so excited for you to be here with us today. Without further ado, I'm going to introduce to you someone who some of you may know and some of you may not, but let me just say she's dynamic, and I call her my niece because I love her mother and I've watched her grow up, and she's just a phenomenal woman. Miss Lori Spicer Robertson is our moderator for our Tri-State Defender in the Community Forums. She is a creative change agent, always pursuing opportunities to transform lives and foster sustainable progress as a natural connector and multi-hyphenate. She currently serves as a healthcare executive in culture and transformation at a global pediatric hospital here in Memphis. And we're not going to call the name, but you know who it is, right? She is also the founder of the DEI Collective, an industry-agnostic collaborative of leaders driving more equitable work environments and communities, and the founder and chief joy maker of Wonder Her, an experimental membership community designed to reconnect women and mothers to a joy of life. Without further ado, I want to introduce Lori to come up and start this forum, but I just have to say, and Tish, come on up.
Where is she?
Lori, come on up. She's phenomenal. Thank you, Lori.
Thank you. All right, good evening. Now, today we're talking about health, so I'm going to say good evening again, because tonight is about energy, about our joy through our health, about seeing health through our wealth. So, good evening. Good evening. So much better. Thank you for that. I'm excited to be here for our next iteration of community forums, and today we are talking about something that is very near and dear to my heart. It is health. As a child, I thought I was going to be a doctor. I went off through college, pre-med, studied, and then I was introduced to chemistry in my junior year. And I had a wonderful internship where the doctor let me deliver babies, learn about sexually transmitted diseases, do all kinds of things that I realized I really don't want to do. And communications is a better path for me. But the people that you see before you chose a path of healthcare, and so we want to hear from them. I am not going to hold us. I want to make sure you get to hear their voices, you learn about who they are. So I'm going to ask each of the panelists to introduce themselves, tell us who you are, your title, your organization and affiliation, and I always give a stump. Give us something that is not on your resume, something fun about you. No pressure. The last week we had award-winning singers, lip singers, no pressure. And then give us the song that brings you joy, because music is also our medicine. So, Mr. No Pressure, we will start with you.
Good evening, everyone.
Good evening.
So, first let me just say thank you to Deidre, Madam Chair, for having me here today. I was trying to find her in the room, around I didn't really know what I was saying yes to, but because she's the person that asked me, I say yes to it. But for those of you who don't know me, my name is Miska Clay Bibbs. I'm a Shelby County Commissioner, past chairwoman of the Shelby County Board of Commissioners, current budget chair, current hospitals and health chair. So I wanted to say that because she mentioned that people chose healthcare as their profession. So it is not my profession. I am truly an education and policy advocate by trade. But somehow on the commission, I found myself being the champion for all things health and wellness through the work that I do. So I will say something that is not on my resume. Probably the fact that I'm excited that I now serve on the board of Regional 1, but it's actually the hospital that I was born in. So for me, that is my purpose as to why I kind of drive that work. I'm a mother of a young man who's about to graduate, thank God. December 13, 2025. But he, through his, just childhood and growing up, he made me watch every single Spider-Man, Marvel, Transformers, whatever movie that was out about a comic book. So I'm probably well versed on that side of things. So if you want to have a conversation about any of that, I can tell you. The song that brings me joy, I don't really have one song because I am a DJ in my head on the side, but I love Stevie Wonder, so I will say 2 songs, which would be As and Rocket Love.
Thank you.
Good evening, everyone, and I am going to start with a ditto to my dear Commissioner Bibbs. When Madam Chair Malone and her partner in crime, Jesse Johnson, called me, I didn't really know what to say, but yes. So here I am. I don't know exactly what I'm talking about or why I am here because I said yes. And then, I'm in the Madam CEO's house, right, Ms. Stockton? Yeah. So it is truly a pleasure to be here. I have spent 32 years in healthcare administration. But what I'll tell you and what I want you to know most is that I am a native of Orange Mound, Tennessee. So it's possible. I spent my formative years in state government where I got to know a lot of my friends and around the state and around the country. Started my healthcare career in Chicago, bounced around to South Carolina, Georgia a couple of times, Grady and Atlanta, and was fortunate 16 years ago to come back to my beloved hometown of Memphis and work at Regional 1 Health, where I serve as Executive Vice President and Chief Administrative Officer. I will not bore you with the details of my portfolio, just to say that it is broad and eclectic, and I love what I do. I tell people every day I drive down Jefferson Street to do one thing, and that's to make a difference in the lives of the people that we serve and to inspire the other Orange Mound natives.
Thank you.
Well, you forgot to do
my song, and again, if you know health, it's a tough job, and I have to rely on my faith in everything I do. So great is thy faithfulness.
Yes.
But now, they drank wine in the Bible.
Yes.
On my resume is that I love laughing with my friends and sharing great wine.
Thank you. Richard.
Now I know I want to spend some time over Regional 1. Richard Ransom, the current Strategic Communications Director for Methodist Le Bonheur Healthcare. Love the new role. As you know, I've been broadcasting for more than 3 decades, and just decided it was time for a change. And I've always been passionate about healthcare, something I've always felt very strongly about, and giving back to the community. And I knew that if I ever was going to leave the TV news business, it was going to have to be for something that the mission I believed in. I love FedEx, they're a wonderful contributor to this community, but I'm not passionate about overnight delivery packages. It's just not my thing. Got approached by Blue Oval City, same thing. Not really passionate about pickup trucks. So this was what called to me, and I just had to wait to find the right opportunity, and the right opportunity came along at just the right time. And I just love what I'm doing here. I can't wait to talk to you more about it. I've got 2 kids, grown kids. One lives in New York City and is pursuing a career in film, and my daughter and her husband and 2 grandkids, which would be my fun thing that's not on the resume, is I'm a great tickler. My grandkids, they call me the tickle monster, and I love to be the tickle monster. So that would probably be the off-resume thing. And favorite song, it's not a little too risque, but my wife and I love to jam to What Lovers Do by Maroon 5. All right. That's my favorite song.
Hi, Dr. Robert D. Colvin. I have the pleasure of being the Chief Medical Officer here at Memphis Health Center. Welcome to our great facility here. Anybody that wants a tour, let me know. Anybody that needs a doctor, let us know. Happy to take care of you here. I started here in 2021, grew up outside of Philly, lived in a town called Pottsville for many years. You may not have heard of that, but you've heard of Yingling beer, drink of the gods. So that is where it was brewed. So it's a great tour if you ever get up there. Some fun facts not there. I'm an ice hockey enthusiast. So in my world, there's 2 seasons. There's Christmas season and Stanley Cup playoff season, which we're in now. So it's a great time of the year. I've coached, ref, played all of that stuff, and I am an official fan-alo. So I think Barry Manilow is one of the greatest singer-songwriters ever of all time. That's it. And the song that always puts a smile to my face is "Walking on Sunshine" by Katrina and the Waves. Also look forward to sharing our knowledge with everybody here, and thank you for having us.
All right, rounding up. Good evening, everyone. I am so grateful to be here and share this opportunity with these panelists. My name is August White, and I currently serve as the Executive Director for the Memphis location of Mental Health Cooperative. What I can tell you is that these ears were made for talking. I went into mental health, and I have just been led thus far through my career, and my steps have been ordered, and this is where I have landed, and I am so gracious to be here. Something fun about me that you may not find on my resume: I am a self-proclaimed brunch connoisseur. I will not turn down a good patio or live music, which leads me to the song that brings me joy is "Before I Let Go." Need I say who it's by? But rest in peace, Frank. Thank you, Frank.
Thank you. Thank you to our mental DJ, our wine enthusiast, our master tickler, our ice hockeyer, and of course, the person who is served to do mental health. So give them a round of applause as we get started. We've talked about the importance of healthcare, so I definitely want to start with Commissioner Bibbs, and as well as Richard Ransom. So as you think about healthcare, it represents a significant portion of the budget for our county. And thinking about the health department, Regional 1, correctional services, how are you managing that increased healthcare costs, but also giving quality care?
Excellent question, considered the mayor just presented his budget today, just about a few hours ago. As well as Dr. Taylor, who runs our health department, did her state of Shelby County regarding health to us earlier today. So the reality of it is we are definitely dealing with more cost because we have to rebuild Regional 1. That is a must-do for us as county commissioners. If you paid anything attention to how we've operated since we came in 2022, that one of the main things that we've been talking about is really important to us is mental health care, which now we have invested in building a brand new facility that will partner with 201 Poplar, which is the jail, around mental health care for those citizens who found themselves at 201. They probably should not be at 201. They really should have some health care regarding their mental issues and a brand new facility. We were able to do that with ARPA dollars. We know that ARPA dollars no longer exist. So the budget that we just heard did not have a tax increase, but it is going to push us around keeping our CIP investments for the completion of a new hospital, but at the same time, based upon what Dr. Taylor presented today, which if you have a chance, it is, this is actually the book that she presented today, and I brought it just because it's very thick and it's full of information, and it's done by districts in zip code. And it really talks about all of the things that we encounter in Shelby County as citizens. So it is now our task to, over the next 3 budget meetings, to make sure that we're investing in the health department in a way in order to tackle that. Based upon this presentation, it shows that heart disease is number 1, cancer is number 2, unintentional injury is number 3, and then these numbers were from 2022, so COVID was still on there as the 4th one. So if you take a look at that, we have to make sure that all investments that we do regarding the health department, as well as who we partner with. Like the thing about the county is we do a lot of investments in our community partners. We have people out here that are already doing the work, such as Ms. Stockton, who's already doing the work here at the health center. So our goal is to invest in community partners so that we don't have to do all of it on our own. So over the next 3 committee meetings, we will make sure that we're doing those types of investments.
Thank you. As we think about investing in community partners, whether that's through time, talent, or treasure, I definitely wanted to ask Richard about Methodist Lebaner's Healthier 901 campaign. It is growing and getting traction, but also any other initiatives that you all are doing in the community. Would love to hear what is the impact that you've seen thus far. How do you continue to grow that message, and can people still get involved?
Absolutely, people can get involved. I think Healthier 901 is what I'm most excited about, and one of the big reasons I joined Methodist Lebaner. When you look at the community health needs assessment, which you mentioned, the top 4, heart disease, cancer, unintentional injuries, and stroke, and COVID-19 still made the list back because of the age of the survey, but nonetheless, that focus has been very much a part of the health of our community, right? It is the leading cause of death. And so what's behind a lot of those numbers? And we realize that obesity is playing a huge role in what's driving up a lot of those numbers. And so it became our mission to do what can we do to encourage people to make healthier choices. And we're not asking people to be rock stars in the gym, but we are asking people to think about how can I change my habits? Because let's face it, it's hard to motivate yourself to make the decisions when you've got that tempting Popeye's chicken meal over here, and you got the lettuce and tomatoes over here, and a lot of times the Popeyes wins, right? And that's not going to stop, and we don't think we're going to stop it. But we do realize that with the challenges of food deserts and everything that a lot of communities are dealing with, that if we can help them in some way to make some healthier choices, get those 5,000 steps in a day, maybe push it up to 7, ideally get up to 10,000 steps a day. It's a challenge, but you can do it. It can be done. And we know that we have to encourage individuals, families and friends, churches and congregations, community leaders, and local businesses and employers to all get involved and be a part of it. And that's been the fun part. And where I come in is trying to get as many people and players as we can in this so that we can get people more excited about it. So that's been our focus, and I think there's a lot of other community outreach things we do, especially when it comes to chronic diseases, how we help folks. I learned today we have 400 people employed just to help with community outreach and chronic diseases alone. 400 people. So we do so many different things that I couldn't even begin to list them all right now. But it's just, it really is a focus of Methodist Lebaner, one of the things that I love about working there.
So as we think about our healthcare, definitely getting the message out there is always important, and having campaigns helps us do that. But I think about my work every day, it's also about access, right? Some of the gaps that we see is just the knowledge barrier, the access, and opening those doors. And sometimes they're invisible barriers or visible barriers that keep us from our healthcare. This question is for Tish. As you think about the work that you do at Regional 1, what would you say is probably the most challenging or pressing issue that you see for Memphians today around our healthcare? And then how is Regional 1 also thinking about ways to address that in a real and very sustainable way? Yes, we're sharing mics.
Lori, thank you for that question. And as I think about it, and we say invisible barriers, visible barriers, it all starts to blend. And so when I think about
access, particularly, not just in our community, but across this country. I'm gonna give you two lanes. The first one is provider capacity and the ability to pay. And so we all know that healthcare services are not free. The people in this room remember well over a decade ago something called the Affordable Care Act that was designed to improve access. Well, there's still major attempts to dismantle that. As we sit here and talk right now, I can tell you they're interviewing commerce in Washington. And so providers, yes, they have mission, they're altruistic, but they have to put food on their tables. And so we have capacity issues, particularly for those who are without insurance. So that's one lane, thinking about how do we finance healthcare in this country, not just in this community. We just talked about the rising cost of healthcare, the cost of drugs. The other barriers, invisible and not, are social determinants of health. So in the healthcare space, I will admit that we are probably just over a decade and really thinking about what are those things that prevent individuals from getting the healthcare that they need when they need it. It's transportation, it's health literacy, it's fear. There's the Tuskegee study, and there's still blue walls that exist in healthcare. And so those are the things that we have started to tackle as an industry. I see my dear friend Kevin Woods, he's a payer. They're rating, I'm just kidding. But thinking about how do we wrap around the whole patient. And I can tell you that 15 years ago, my colleagues across the country all said, well, that's not the hospital's responsibility. We have now come to understand that it is certainly the healthcare's responsibility to participate in the wholeness of an individual's care. Because if we don't, they will be where? In the emergency room, sick, probably about to die, stage 4 cancer. I read something in an article today, is that, the diagnoses, the oncologists say over 50% of their cancer diagnoses are late stage because of what? Lack of access and lack of screenings. And so we have to look holistically at the person, and how do we partner with transportation agencies? How do we partner with community providers? How do we teach people to understand their health status and how you manage your diabetes or your hypertension? And so that's what we as providers and community members must do. Now, what we are doing at Regional One Health, we have a One Health program, and it is a holistic program. We started that program probably 6 years ago, focused on what we call high utilizers of that expensive health care, the emergency room, because they had nowhere else to go. And so through that program, we help them find housing assistance, we help them qualify for benefits, we provide food pantry access, because food deserts are real contributors to poor health status. And so that's one thing that we're doing. And then in a number of our services, women's services, oncology, primary care, we've started to deploy health navigators. We would say your primary care doctor is your medical home. Well, you got a lot of documentation to do, a lot of note taking, so you need that extra support to help your patient navigate the healthcare delivery system. We have the best healthcare in the world in the United States, and very good healthcare here in Memphis. But the healthcare delivery system is complex. I told you I've been in the business 30-something years, and still today, if a loved one has to access the system, I'm volunteering to be their navigator. Because it's hard and we have to do it. And so there are barriers that we have to break down, but we really have to look at the whole person to make sure that they can get the access when they need it in time. Because it's going to affect costs. Yeah. And so that's my long-winded answer to the invisible and visible barriers, but they are certainly real.
Amen. Thank you.
So Dr. Coley, question for you. In your many years of medical leadership, and thinking about what Tish just shared in terms of the wholeness of care, what strategies have you seen to be successful in terms of providing access, closing some of those barriers and gaps, but also addressing preventative care? Because sometimes we offer care, but it's not always preventative care. So what does that look like for underestimated communities, but also the entire community?
And the question that you asked really is about a 4-hour conference. So Tish did a great job on answering some of that. To go in a little different thing to address some of the questions, looking at access here, we really try to have to meet people where they're at, right? So we do have hours that are not normal hours, so we do have Saturday morning hours for adult medicine every single Saturday, some dental hours as well as pediatric hours on this Saturday. We do have same-day appointments, so we have immediate access here, and we allow walk-in patients. We have a great buy-in from our staff here and from the organization as a whole to really, again, meet people where they're at. And I'm not sure whether you heard this. This happened in New York several years ago. A train came through. Father came on with his 2 kids, ages 4 and 5. Kids were running around the car, not really causing any major havoc, but running around the car, causing, not really nice. And finally somebody said, "Hey, pal, your kids are running around here. What's going on?" So on and so forth. He looked up, apologized to the people, and said, "The kids just lost their mom, and I just lost my wife." And changes the conversation a little bit. So really what we've instilled here is trying to meet patients where they're at, and knowing that from some of the barriers that Tish talked about, transportation barriers and babysitting barriers and all of that stuff, people can be late, people aren't always on time, so we don't stop access just because you're 5-10 minutes late. We really try to work with patients as best we can. We have a mobile van which can see adult patients as well as dental patients. That is really organized by our outreach team led by Audra Elliott. I think she was here, she may be here still, does a great job in organizing that, bringing the services out to our patients. So we're really looking for those kind of partnerships. So if you know of anybody, church organization or anything else that would like us to come, we can bring the van, either do dental or medical, to do both. It's a little crazy. It's a big van, but not that big. But we can do either services, so we're trying to meet the people there. So we're always looking at that. And we do have a sliding fee schedule. So we talked about those that can't pay. We see everybody, regardless if they can pay or not. We do have a sliding fee for those that don't have insurance. That's some of the ways that we're dealing with some of the access issues here, because if we can't get them in, then we can't treat them. The preventative care is a whole bailiwick of, it's a very difficult nut to crack, to be honest, on a lot of this. Because the 2 barriers that we deal with are general educational barriers. One, can the patient read a food label? Can the patient read a medical label? Can they properly understand what they're being told? So a general educational barrier is one. We then get into health literacy barrier, to where on some of those preventative things that Tish talked about. So you talk to them, can we educate them to understand the complications of diabetes 20 years from now? They're going to have their leg cut off, that they're going to be on dialysis, they're going to go blind, because right now I feel fine. So to prevent those complications from happening, we need to educate people now, which is tough. From a testing standpoint, I'm saddened. I'm really saddened as a physician. In 2025, for somebody to die of colon cancer or breast cancer, you will have the outliers. You'll have that 20-year-old that has breast cancer that we're not going to check, and it's just an unfortunate thing. But to have that 50-year-old with metastatic breast cancer, metastatic colon cancer, who's refused these screening tests that we recommend every single visit is an absolute shame. You have diagnoses such as ALS or Lou Gehrig's disease, pancreatic cancer. There's nothing you can do about it. It just is a fact of life. Enjoy your life. There's nothing we can do. But if we catch colon cancer, if we catch breast cancer early enough, we can treat it, we can cure people. So to get them to understand that, to do the preventative testing, takes time, and it's really a battle. We've recently started here a children's wellness clinic through Dr. Jogel, who came on board to us, a full-time pediatrician. So we're looking to be partnering with organizations about that. It's funny that you mentioned the Obesity 901 Health. The major part of that wellness clinic is weight management, is partnering with other organizations that are going to help us deal with the weight in childhood so that we avoid the complications when they become an adult. Another thing that we're working with is the HPV vaccine, human papillomavirus vaccine. It really is an anti-cancer vaccine. But because HPV is spread through sexual acts, my kid isn't sexually active. Well, your kid probably is sexually active. So to try to convince parents of that, to try to educate that this isn't, we're not recommending this because we think your daughter is hanging from a pole, but it's to prevent cancer down the line. And that's a tough sell. That is really a tough sell as part of an educational thing. We're working with businesses who don't offer health insurance to say, hey, we do have a sliding fee schedule. We understand why you're not offering insurance. Have your employees come to us rather than, so we can treat their high blood pressure, treat their diabetes, so that they don't have those complications down the line. And the final thing is we are here a multi-specialty practice, right? We have an adult service line. We do have Dr. Ellen, who is here, one of our adult providers, excellent doctor here. We have a pediatric service line. We have an OBGYN service line. We have ophthalmology, dentistry, podiatry. We have a pharmacy that can give meds at a discount. So the access part of it, as well as the preventative part, and we have a 3D mammography here in the building. So we can do a lot of the preventative things right here as a one-stop shop. So we're hoping by our better access and the services that we provide, we can deal with some of the preventative treatment and not have the more expensive care down the road. Thank you.
Thank you, Dr. Hope. Switching gears a little bit, we often think about our physical health when we talk about healthcare, but rarely do we think about our mental health. And so, speaking to you, Ms. August, looking at what are the steps that organizations and systems can take to normalize it, because as a community of color, mental health is still a stigma, whether we want to admit it or not. A friend of mine often says sometimes you need mental health therapy for all the people around you who do not get it. But some people don't believe that, right? Amen to that. So tell me, what steps would you give to normalize this in our systems, but also how can we evolve the practice?
Okay, and that's such an important question. So what I will start off by saying is, I'm a therapist who has a therapist. Let me normalize this for you, okay? That's so important. The stigma around mental health, especially in communities of color, it didn't happen overnight. It's rooted in generations of mistrust, lack of access, and we've been socialized in thinking that we can just pray it away or push through it. You know, we've normalized this as a culture. So I have 3 pieces of advice that I would offer. The first is for systems and organizations. I think it's important that we learn to lead with cultural humility. And what I mean by that is investing in providers that reflect the communities that you serve. We have to create safe spaces spaces where our consumers, where our patients feel welcomed, where they don't feel judged. That's very important when you enter into a setting. Second, and this is probably what I feel is the most important in the space of mental health, is that we start changing the narratives and we truly meet people where they are. And that's not just the physical aspect of going out, but changing the narrative from what happened to you to how is this affecting you now and how I can support you through this. And learning to make it okay to say that I'm not okay, and treat mental health as a strength and not a weakness. The last thing, as far as normalizing mental health in our everyday spaces, meaning our work environments, our schools, churches, barbershops, those spaces, having the conversation. So events like what we're doing right now, where we have the opportunity to really talk about it and put it out there, is important to making it a part of our day-to-day conversations, so that it becomes a fabric, part of the fabric of what we do in our day-to-day in creating those networks.
Thank you. Back to you, Tish. You referenced earlier One Health, and so Regional One has started to look into integrating both behavioral and physical health services. What has this taught you about the patients that you serve, their outcomes, but also where can we grow in this space as we think about evolving our healthcare?
Thank you, Lori. So the first thing I want to do is just ditto Dr. DeCola and Ms. August. Mental health is a real issue in our communities. There is a lack of providers in our community. Way too often, those of us, including those of us who think that we are not culturally competent. I don't know if we can still say that word now, but we used to say it 20 years ago. And so we have no cultural humility. And so we have to, one, look for partners to help with emotional well-being. We ourselves have to be sensitive to being able to meet people where they are and understanding what triggers an emotional imbalance. So I will say to you, everybody in this room that's walked into a hospital or a doctor's office, you've had an emotional trigger. Because it's a scary place, right? You didn't expect to be in that car accident or your loved one, so it triggers emotion. And so I think, as I talk about how providers are now looking at the whole person and really trying to figure out how you respond to these social determinants that prevent individuals from getting the care that they need, we are also very in tune to trying to understand your emotional health. And so if you walk into a primary care office today, whether it's at Regional One Health, whether it's at the Memphis Health Center, or whatever community doctor you're doing, they're doing a screening on you because they want to understand your emotional health, those things that are preventing you from living life to the fullest or having joy. And so that's one avenue. So I'm going to screen you, but now that I've screened you and I know whatever the rating is, Kevin can probably tell us, I gotta get you to somebody who can help you with your emotional health. It's real, we don't talk about it. So we're starting in our primary care settings in our One Health program. We do screenings and we try to help people find resources. It is not easy. I said there are a lack of providers all over this country when you think about providing manpower. It's compounded when we talk about behavioral health. And so we just have to keep at it. We have to be intentional about partnerships. I'm going to, again, show my age. We got to be culturally competent and sensitive to the fear factor of entering into any healthcare setting. Because you never know what the answer is going to be. You don't know what that lab result is going to be. And so we have to train our staff to not just de-escalate, but really prepare yourselves to meet people where they are and then help them connect to the emotional support that they need and not be afraid of it. So that's my answer. We don't have a behavioral health program, but we do try to connect with community providers.
Thank you, Tish. Shifting to talk about policy, when I think about healthcare, we want to think about what's sustainable, what will stay with us and really grow the health landscape of our community. And so for Commissioner Bibb, are there things that are upcoming or current that are happening with Shelby County that promote healthier lifestyle, healthier behaviors, but also give us different outcomes that we're looking forward to in the future in terms of healthcare?
Excellent question. In 2022, when this new body of commissioners came on, we decided to use the opioid settlement money to create a brand new program called the District Connectors. And within that, it probably was not, it was very much out of the box thinking, because our goal was to make sure you had someone in each commission district that actually understood the makeup of that district, demographics, some of the health issues, some of the economic equity issues, all of the things. So that person is responsible for bringing all of the community partners together in that commission district. And what has happened is, not only have we got really great data back, but we also now have monthly, or I think now every quarterly, meetings around bringing those community partners together and engaging with the citizens in each commission district, but at the same time, giving them the opportunity to work together and learn information without it just being a pamphlet. So then that way they're excited about working with a community partner, they're excited about going to the doctor, they're excited about mental health in a different way, more so mental wellness. Is kind of the way we've termed it. And that's what the money we've already used. In Shelby County regarding employees as well as now citizens, we talk about Shelby Cares and we call it Healthy Shelby. And we're partnered with UT Health Science Center right now in 2 places, trying to make that go to 13 very quicker. But right now you can go to a center on 3rd Street, you can go to the brand new one that opened in Binghamton. There's one that's going to open in Raleigh within the next couple of months. But after hearing today's presentation, our goal is to move that very quickly across Shelby County. And the thing about Shelby Cares that's fun is the fact that it's not replacing your primary care provider, it is supporting whatever the primary care provider has told you need to do. You will have a health coach and you also have a mental wellness coach. And the amount of testimonies that we have come to us pretty much at this point quarterly around how health has changed some of our citizens losing weight, cooking classes, understanding how to better take care of some issues that they've had were pre-diabetic and now they're not. So a lot of great testimonies. So that's how we're really thinking about it. And I do want to acknowledge the fact that we do work with Cigna for our employees to come up with some really exciting, engaging ways for them to take care of their health. Through some fun ways, the same way that we've done. We have partners throughout Shelby County where for those who want to go work out, they can go work out. For those who want to partner with some health coaches, they can. We've tried to do it at 160 North Main. I can't necessarily say how many people participate because I'm not ever there on those days. We probably need to challenge each other as a commission in order to participate. But the reality of it is we're trying to use our dollars in fun and engaging ways, but also make a difference.
Thank you for sharing that. Dr. Coley, thinking about how we are meeting people where they are. I think you mentioned that before as I think about what Commissioner Bibbs just shared in terms of Shelby Cares. There's more care that is happening to meet people, whatever their health needs are. And so we saw with the pandemic that telehealth really increased. And we just had this conversation at our hospital as well, but how do you see it really shifting the landscape and future of access, but also making sure we are handling chronic care management in a very different way by meeting people where they are?
Appreciate it. Excellent question. Commissioner Bibbs, if you want to partner with us, we will love to have some of those things here. So we can talk afterwards. We will love to have some of that here.
She's already told me.
That's great. Excellent. Telehealth. All right. I think telehealth has its place. When you're dealing with a younger, healthy patient with a sore throat, headaches, something straightforward. You don't want to take a time off from work. You want your doctor to call you. Great, super. I think that's a great But I think there's a lot of limitations with it, and I do resist a little bit a movement towards shifting care to a telehealth model and decreasing the in-person visit. Again, we're looking at a middle-aged, older-age person. There may be some medical issues with that patient. If that patient were to go into atrial fibrillation, which is an abnormal cardiac rhythm which increases your chance for a stroke, I can't diagnose that over the phone. If you're a diabetic and all of a sudden your circulation in your feet are starting to go a little bit, I can't diagnose that over the phone. So if it's another 3 to 6 months until I see you, that's another 3 or 6 months that you're at a high risk for major health issues. The other part of that too is you lose that physical touch with your patients. So you have a physical contact with somebody that's in front of you, and this may come from my osteopathic background, but there's a power of touch. There's a power of feeling. When I'm touching my patient, there is a connection there. It's similar to the fact you'll hear relationship people talking about couples that are happy or holding hands, they're holding each other, they're touching each other. There's a power to that that's lost through the telehealth. Can we supply equipment to patients so that I can hear the heart rate and all that kind of stuff? The answer is yes. Very expensive. I'm sure Commissioner Bibbs will comment on that. It's not practical. It's not practical for 5,000 people to get $5,000 worth of equipment that can do things. It's just not going to happen. So yes, it's important, but I think the role of telehealth is an adjunct to the in-person visit. What we're doing here at Memphis Health Center is we're hopefully we'll kick it off over the next 2 or 3 weeks, is develop a chronic care management service line. So this service line will work in conjunction with the in-person visit, not take the place of it. So what does that do for the patient and for us? It provides another touch point once a month where an LPN or an RN will contact that patient, see how they're doing, reinforce what the inpatient visit had, answer any questions that the patient has from that visit, right? We all have a visit. I'm the same way. I see my doc, I'm like, I should have asked this, and this. Well, now I'm going to get a phone call a couple weeks later from my chronic care management person. Now I can ask. So there is a way to do that. It gives the person a point of contact. We're a medium-sized office. There are larger offices, and you have hospital systems here. I don't think if any of us tell you that our phone system is the top notch, I think they'll be lying. You know, people go into phone trees, they put messages, the heck with it, I'm not even going to call the office. The chronic care management person will give that patient a number and a person to call that will pick up the phone with a question. What's the benefit of this? This will make our hospital representatives here very happy. Decreasing ER visits, right? Decrease, because we get dinged too. So we get penalized as much as the hospitals do when our patients show up at their facility. So if we have a mechanism to where we can prevent that helps everybody. Decreases the cost of care from a whole system standpoint. Increases office visits to where, hey, Mrs. Jones, you don't sound too good. Why don't you come to the office? Without that phone call, Mrs. Jones doesn't feel good for 2 more days and goes to the ER. And back to our first comment, helps with preventative care, where we can emphasize the need and have more of a time to educate the person because as we talked about before, we are short-staffed, right? All the providers are short-staffed. We may not have 30 minutes to talk to somebody about why a mammogram is important. The chronic care management service does. So they're going to help us with the preventative services. A, B, get people into the office. C, decrease total cost of care and decrease ER visits. So I like telemedicine. I think there's a role for telemedicine, but I'm really pushing back against the move to convert a large section. Oh, we'll just do a televisit. We'll just do a televisit. It's not the same as an in-person visit. Thank you.
Thank you for that. You have to listen to your body in the early stages of perimenopause, for those who are not familiar. It's real friendly. So I just grabbed a happy seat. Think about your questions, because this is our final question for the panel. But also when we think about, thank you, Dr. Coley, for that reference around telehealth. As you think about many of the things that you all share, meeting people where they are, making sure there is great messaging and engagement and partnerships, this is for you, Richard. Storytelling to me, my background is communications and PR too, and so when I think about how do you spread the news, the knowledge, fill the gaps, how can we do a better job in our community of sharing and storytelling so people see the benefits of great health? And what other partnerships and engagement are important?
Very good question. I think the biggest thing that worked in TV news and works in healthcare too, and that is listening to people. And do not think that you know the answers. And also finding a way to communicate at levels they understand. One of my biggest challenges in my short time at Methodist Le Bonheur is, doctors love to talk in very technical terms. And they're very educated, they like to use big words. And I always have to say, no, we need to be more conversational. We need to talk to people and use words like people use when they're talking to people. And that is one reason why I think the Healthier 911 program with the app that we have reaches people where they're at too, because everybody's got a phone. And this is one way we can get right to them and message them about, in a conversational way, in ways they can relate to and understand, here are some simple things you can do today to improve your diet, to improve the exercise you're getting today, and make you feel healthier about what you accomplished on that day, and not make it this grandiose program that you have to focus on losing 30 pounds tomorrow. No, it's a step, literally a step at a time. And when you hear the statistics and learn just how much 5 pounds can make in lowering your odds of cancer and lowering the need for a hip replacement, whatever it happens to be, the benefits just multiply over and over again. So I guess for me, it's meeting people where they're at, which has been the phrase of the night apparently, but it really is true, because if you're speaking above people and you're not reaching them at a level that they can understand, you haven't accomplished anything. So.
Thank you. Dr. August, to close us out on this round of questions, I would love to hear from you around how do we make sure we're thinking about sincere, intentional partnerships as we're trying to get early and preventative care before we reach crisis state.
Absolutely. So what I can say is that I have seen firsthand how early intervention can change the entire trajectory of a person's life. What I would offer first is for our school systems, if I could be aspirational for a moment. Imagine if we had a behavioral health or mental health component in every school, where we could start shifting from responding to crisis to actually having someone there to support not just the students, but also the teachers and the parents. So that would be the first suggestion. The second would be with our churches, because our faith leaders, that's typically the first touch point when we're struggling. I may rub some people the wrong way. Many of our faith-based leaders may not be completely equipped to deal with the type of mental health issues that we're seeing today. Now, they may argue that they've got the higher power, so I'm going to counter that with, he also gave us mental health professionals, so take advantage of that. So putting resources in the churches to help, better support our faith-based leaders. And then lastly, our neighborhoods. We have to get outside. We have to move outside of our buildings and our clinics. So I would love to see more pop-up wellness events, having conversations or listening events at the barber shops, at the beauty salons. This is where you're gonna get a lot of the pulse of what's going on with our city, and especially with the people who may be suffering or having mental health issues. So I close with, it takes a village, you know. It takes a network to build that net, and those are just a few of the areas that we could have the greatest impact.
We'll open it up to the floor for questions. Yes, please.
First of all, my name is Gina Hoods. I've been a patient here at Memphis Health Center since April of, it's been over a year and a half, sorry, I have a little trouble with dates. When I initially came here, I didn't have insurance. Y'all worked with me, it was a beautiful thing. I was seeing, everybody here, and, Dr. Ellen insisted that the social worker helped me get all of my appointments, and I was like, woo, but I was well taken care of, and I praise the Lord for that. I had a primary care physician, was taking all of my medicines, but it's genetics, diabetes, high blood pressure runs in my family, unfortunately. And on January 19th, this is my testimony, and forgive me, I was at work and I wasn't feeling right, and I told them to call the ambulance. And it turned out my blood pressure was 234/120, and I was taking my medicines. And I ended up, long story short, having 3 hospitalizations over 2 weeks, 2 different health facilities, but I didn't leave the hospital through the morgue, which is what should have happened with the blood pressure of 234/120. And I praise God for that. He kept me here for a reason, for a purpose. And when I got sick, I had insurance. I have great insurance. So I praise the Lord for that insurance. And I utilized all of it, and I still do. And I could go anywhere with my health insurance, but I choose to stay here because I'm not just a number. I'm a patient, I'm a person who matters. When I got discharged from the hospital, I had trouble speaking. I couldn't think right. I walked into the door, and I think her name is Teresa, I get it wrong. She knew something wasn't right when I stepped to the window, because I'm always talking and chattering and blah, blah, blah. Anybody here can tell you that. And she said, she came from around the desk and said, something is not right. I'm going to get somebody to take you. We work through that. Every time I come in here, I'm not just a patient, I'm a person. From the people who help keep the building clean. But I do have depression, and it took me 4 major things to finally accept that I'm going to be on medicine for the rest of my life. And I see nurse practitioner around here. I go to my appointments when I'm in crisis and go to her because I don't have a therapist, and I'm trying to find one. And I have good insurance. Where do I go? I just want to be better. I'm good now, but I want to be great. So where do I go? That's the question.
Yeah, so I will take that. Thank you, first of all, for sharing your story. That took a lot of bravery just to put that out there again, to say that what you're going through. So I'm going to go ahead and give myself a shameless plug. As I stated earlier, I work for Mental Health Cooperative. We're a nonprofit mental health agency, and one thing that we pride ourselves on is no one is turned away when you walk through our doors. So we can start there to help you find the best fit for you, because therapy definitely isn't one of those, one fit wonders. It's finding the right fit for what you're going through and helping you navigate your journey. So we can talk afterwards if you'd like. I'm open to helping you find that place.
Thank you, Dr. August, and thank you for sharing your story. Yes, sir.
Yes, my name is Doug Sessions. I love what you said about reaching the children early. I love to know what type of roadmap to lead to that, but that's a discussion way too long for tonight.
Yeah.
But my question is, there's a lot of severe mental breakdowns now, and they're still using the police to handle those. And a lot of people are really getting injured when it's not necessary. Is there a roadmap in place to replace them with a care professional?
So I can just speak to what I know about our current system, especially working with the CIT officers and crisis intervention team. There are care models where those trained officers arrive on the scene, and there can also be medical professionals that accompany them to help de-escalate the situation. So what I encourage people to do is when you contact the police, if it is a mental health emergency, do communicate that it is a mental health emergency and you're requesting the trained CIT response because they are trained to handle that type of situation.
Thank you.
Thank you. Other questions? Yes, sir.
So, of course, we all know there is a huge shortage. Chief Medico had mentioned this in healthcare. As an advocate of trying to understand how can we address the demand versus the supply with healthcare shortage, why are not young people are getting more into healthcare nowadays? And if you're seeing an increase of that happening, what a person like myself that is very passionate about healthcare can go to these high schools and talk about the professions and let them know how, there is a lot of needs, especially in our community. And not only that, people who graduate, how can we bring them back in the community to help drive the process of addressing the gap between the demand and the supply in the healthcare shortage?
Hopefully I'll remember all of that, but okay. Excellent point. So a couple of things. So I know that there is a new osteopathic school that is in town, and I know that they are looking at having students come to them from the Memphis area to try to build that a little bit. So there is that part of it there. Medicine as a whole has drastically changed. So, and not necessarily for the better in terms of the perception of people moving through. There's a lot of paperwork, a lot of regulations. A lot of the private practice model no longer really exists. None of the young kids are coming out wanting to start a practice, wanting to open. I was in private practice for 17 years, and I know my CEO is here, but just forgive me for a second. I would go back to private practice tomorrow if it was an option. It's a beautiful thing. It's a great thing. It's just not viable anymore. So you have people that are going through the system that the employment model doesn't really appeal, and honestly, we as more of the senior physicians haven't really presented a positive view on that anyway. Because if you talk to most physicians, man, it was great 30 years ago. It was fabulous. Oh yeah, it was great. Now, it is just horrendous. I can't prescribe the medications I want. I have the insurances all over me, left and right. I have to use this EMR system and hit buttons. I'm not hitting buttons. I hate computers. I don't like it. I don't want to do it. And it just goes on and on and on. So we haven't done a great job in putting forth medicine. The other switch that has been flipped, unfortunately, is medicine is no longer a profession. And I'm sorry, I don't want to speak in absolutes, so just understand what I'm trying to say, guys. I'm not trying to speak in absolutes. But it's not a profession anymore where the health of the patient is the most important thing. Where you had the doctor going to the person's house for house calls. Where you were able to stay late. If the person came late, you were able to stay late and that was okay. A situation to where, hey, the person can't pay, that's okay. We're not going to charge him the copay, we'll just charge the insurance. All that has changed, and now it's a job. I get my check from Methodist Lubbock every 2 weeks. I'm the janitor. I'm a janitor. I'm replaceable. Methodist doesn't care about me. Regional 1 doesn't care about me. Baptist doesn't care about me. And I just want to make sure I'm equal among everything. You know, so if they lose a family practice, now maybe the neurosurgeon is important because they bring in money and so on and so forth. But if a family practice leaves, there's somebody else that'll fall in there. There's somebody else that'll come in there. So it's becoming a job, not a profession. It's not my business that I'm taking care of, that I'm going to nurture, that I'm going to take care of, that I'm going to make sure things are good. I come in at 8, I leave at 5, I get my paycheck. Great. I have to hit some quality metrics there. That's great. Maybe I get a bonus. Super. So medicine has changed, and we've not done a great job in communicating the joy of a patient that I had up in Rossville that gave me a thank you card that I saved their mom's life. You don't have that. We're not communicating, and I'm not here to tell you I'm not the best physician ever. I'm not. But I had somebody come in with a cystitis, very painful. We found out that she was doctor shopping. She was getting 400 Percocet a month. And she said, time out. Drove her to the mental health place ourselves. Closed my hours for the afternoon. Could you imagine anybody doing that, going to Methodist, going, hey guys, I'm driving this person over here. I'm canceling all my patients for the afternoon. Very tough to do. This is when I was in private practice. I got a page note from the lady that I saved her life. How do I put that in money? What is my bonus for that? There is none. There's nothing that anybody can do to make up for that letter, to make up for that thing. And when you're in a room and you see a patient, and I'm sorry for taking time, and they tell you, hey, my grandson just died of a drug overdose. And you're in that room and you're crying with that patient and you're praying with that patient, forget the hypertension, that's really not important. And that visit becomes a 45-minute visit, and I'm pushing patients back and I'm not meeting my quality numbers for the day and all that kind of stuff, that's me, that's my practice. But when it's a job, when I'm being looked at, when I'm being viewed, it's a different situation. It's just a different situation. I can't put a pin on it. So we've not done a great job in that. We need to do a better job in promoting the professional part of. And if anybody has any ideas, I'm all in favor, because I'm trying to get some of that here, right? It's a tough situation with the younger people coming up. Don't buy into that. Don't know that, because they get a paycheck every 2 weeks, and they go on with their lives, and they're fine. It's a tough situation. So we are trying. I will give another shameless plug for my friend August here. Another shameless plug. As an FQHC, people can go on and get federal assistance for their loans. So it's $50,000 for a 2-year commitment to work in an FQHC, and then $25,000 a year after that. So if you have somebody with medical loans, then we don't do the loan. I can't guarantee anything, but we will support that application. So if there is somebody out there with either a nurse practitioner or a doctor with loans and they come here, they can apply for that, and that's a way we can augment them and help them pay off, because the cost of medicine, the other thing is, and I apologize. The other thing is, my medical tuition was $80,000. Graduated in '92. You're looking at close to $500,000 now. You know, you're looking at undergrad at $45,000, and you're looking at $100,000 just for undergrad at best, and then another $50,000 to $60,000 plus living expenses for 4 years of medical school. So you have guys coming out with $300,000, $400,000, $500,000 worth of debt. They don't want to work for $85,000 in some FQHC. You know, they want to work at an upper level, or they're going into specialties GI, cardiology, they're not becoming family physicians doing this because they have $3,000, $4,000 a month just in student loans before their house and before their car and before their wife and all the other bills that we have. That's the other part of medicine that is getting people away from primary care and into more specialty care, which is hurting the family practice pool.
So build on what the doctor's saying, if I could. And maybe Tish would agree with me on this. At least at the hospital level, one thing I have really been struck with is how often I hear about the impact of COVID and how it just sucked the fun out of medicine for so many people. It took all the fun out of it. They still have PTSD over it. And so we're trying desperately to recruit and retain the people we have, and raising the pay structure and trying to bring fun back into the job and the passion back into the job, because nothing we can do about it, but COVID really played a huge role in just taking a lot of that I guess the fun out of being in medicine, that drew a lot of people into the profession.
Well, thank you. We appreciate this panel. We're going to close us out. Thank you for those closing words. One word for each of you to follow. One word. Just one word. Just one. We're gonna skip Dr. DePauli. Yes, closing comments. The Memphis Heals, because today we talked about closing the gap between mental, public, community health. Thinking about policies, and so as you think about that work, that effort, it doesn't sit in one seat, it doesn't sit in hospitals and clinics, it sits with all of us. And so Memphis Heals, if Commissioner Bibb, excuse me.
So you threw me when you said one word. I had a whole I'm just gonna have to do it for the good of the group.
Okay.
So Memphis Heals, if you remember how connected we are to one another. You cannot escape the hurt and pain of Memphis by moving to a new zip code. I believe Memphis will heal when we care for each other's well-being, regardless of the zip code. That means, even if that means one community gets more money at this point, that means they're able to be great, so then we all can be great. That's true equity.
Thank you. Amen. Tish.
Not quite that long, but so Memphis Heals is our communities, not our community, because we all look, walk, talk differently. It's healthy, and we have true opportunity for economic mobility.
Amen.
Well, there's a theme here tonight. I wrote, Memphis Heals if the whole community, in caps, the whole community comes to the realization that a rising tide lifts all boats.
Amen.
All right.
Dr. August.
We're leaving him for last. Okay, so I have Memphis Heals if we listen deeply to our communities, believe that every block, every voice, every person holds the power to transform the city.
Thank you to this awesome panel. Thank you to you all in the audience for being here with us. Dr. DePauli knows that I love him. We appreciate you being here. Thank you to the Tri-State Defender for creating these spaces. Thank you all for indulging me during my perimenopause moment. I'm refreshed again now, so let's move on. But thank you, panelists. Thank you for all that you have shared. Hopefully it was enriching for you all, and we will welcome Calvin Anderson to close us out.
Thank you. At least you passed the mic, didn't drop the mic. Let me say, first of all, thank you so much to this great audience for taking the time to be here with us as Tri-State Defender comes back into our respective communities. Let me thank my great friend, CEO of the Memphis Health Center, Ms. Lois Stockton, for opening the doors of the Health Center and having Tri-State Defender here. With that theme being meeting people where they are, Ms. Stockton allowed us to meet people where they are here at Memphis Health Center. So thank you, Ms. White, Dr. McCauley, Mr. Ransom, Ms. Townsend, Commissioner Bibbs for being here with us, and our great and excellent moderator, Ms. Lori Robinson Spicer, Ms. Spicer Robinson. I got it. So with Tri-State Defender, our effort and our intention on doing our community forums really is to come back within our respective communities where our readers and subscribers reside, to be first-hand interaction with our community of readers. We had a forum that was in April. We have another one that's coming up in July the 16th, and it will be Commissioner Bibbs on education, Mr. Woods, and we will be doing that out in the Hickory Hills community.
That's District 11, you're coming home.
Right, coming home to you. We also have Miss Ely, who is our excellent multimedia marketing and sales representative with Tri-State Defender. If any of you need anything that you want to see advertised, sponsored in the press, then Andrea is the person for you to make contact. We have QR codes for both the subscriptions as well as QR codes that we really want you to use for survey feedback from our forum today. And we have gift bags for our panelists and our moderator.
Well prepared, y'all got ready.
Say thank you for attending this community forum. Our next one is in July, but I also want to thank my two vendors for coming out. We have Jasper Float Spa and Wellness with Miss Antoinette, with all your rest therapy and massages and oils and everything that you need. So please get information from her, and also from Chanel and Jackie from Nature Birth Services. So get information from them as well, just in case you have someone in your family that's looking for that type of service for family planning. Thank you and good night.
All right.